Oral health. Despite being entirely preventable, oral diseases are a significant health burden for many nations and have a lifetime impact on people, causing pain, discomfort, disfigurement, and even death. An estimated 3.5 billion people are impacted by oral disorders. According to Global Burden of Disease 2019, untreated dental caries, tooth decay, in permanent teeth is the most prevalent illness. The cost of treating oral health issues typically excludes them from universal health care. The majority of low and middle-income nations do not have enough services to prevent and treat diseases relating to oral health. A variety of modifiable risk factors, including sugar consumption, cigarette use, alcohol use, poor hygiene, and their underlying social and economic determinants, contribute to the development of oral disorders. These risk factors are also common to many non-communicable diseases. Overview. The majority of oral health disorders can be treated when they are young and are mainly avoidable. Dental caries, tooth decay, periodontal disorders, tooth loss, and oral malignancies account for the majority of occurrences. Orofacial clefts, NOMA, a severe gangrenous disease that begins in the mouth and primarily affects youngsters, and orodental trauma are further oral disorders of public health significance. About 3.5 billion people worldwide suffer from oral disorders, with 3 out of every 4 of them living in middle-income countries, according to the WHO Global Oral Health Status Report, 2022. Primary tooth decay affects 514 million children worldwide, whereas permanent tooth decay is estimated to affect 2 billion people. Because of increased urbanization and modifications in living conditions, the prevalence of the major oral illnesses is continuing to rise worldwide. The availability and affordability of foods with a high sugar content, insufficient exposure to fluoride, found in the water supply and oral hygiene products like toothpaste, and limited access to oral healthcare services in the community are the main causes of this. The promotion of sugary foods and drinks, as well as alcohol and cigarettes, has increased consumer use of goods that worsen oral health issues and other NCDs. Dental caries, tooth decay. Dental caries happens when plaque builds up on the surface of a tooth and reacts with the free sugars, all sugars that have been added to food by the manufacturer, cook, or consumer, as well as sugars that are naturally present in honey, syrups, and fruit juices, to create acids that gradually erode the tooth. Continued use of free sweets at a high rate, insufficient fluoride exposure, and failure to brush away plaque can result in caries, discomfort, and occasionally tooth loss and infection. Periodontal, gum, disease. The gums and bones supporting the teeth are both impacted by periodontal disease. Pain, bleeding or swollen gums, gingivitis, and occasionally poor breath are symptoms of the condition. When the condition is more severe, the gum can separate from the tooth and its supporting bone, resulting in teeth becoming loose and occasionally falling off. Over 1 billion cases of severe periodontal disease are thought to exist worldwide, affecting about 19% of adult population. Poor dental hygiene and cigarette use are the main causes of periodontal disease. Edentulism, total tooth loss. In most cases, losing teeth is the result of a lifetime of oral disease, primarily advanced dental caries and severe periodontal disease, although it can also be brought on by trauma or other factors. In persons aged 20 or older, the estimated global average prevalence of full tooth loss is close to 7%. A substantially greater global frequency of 23% has been predicted for adults 60 years or older. Losing teeth can be emotionally upsetting, detrimental to one's social life, and functionally restrictive. Oral cancer. Oral cancer, which includes tumors of the lip, various oral tissues, and oropharynx, is the 13th most prevalent cancer overall. In 2020, there will likely be 177,757 fatal cases and 377,713 new cases of lip and oral cavity cancer worldwide. Males are more likely to develop oral cancer than women, and it is more lethal in men than it is in women. It also varies greatly depending on socioeconomic status. Use of areca nuts, betel quid, alcohol, and tobacco are some of the main causes of oral cancer. Infections with the human papillomavirus cause an increasing proportion of young people's mouth malignancies in North America and Europe. Orodental trauma. Orodental trauma happens when the mouth, teeth, or oral cavity are hurt. According to the most recent estimates, 1 billion people are afflicted, with a frequency of about 20% among children under the age of 12. Environmental causes and oral variables like misaligned teeth might lead to orodental trauma, such as unsafe playgrounds, risk-taking behavior, road accidents, and violence. Treatment is expensive, time-consuming, and occasionally even results in tooth loss, which has implications for quality of life and the development of the face and mind. Noma. Noma is a serious gangrenous condition that affects the mouth and face. The majority of those afflicted are children between the ages of 2 and 6 who are malnourished, ill with an infectious condition, live in severe poverty, have poor dental hygiene, or have impaired immune systems. Despite cases being documented in Asia and Latin America, Noma is primarily found in sub-Saharan Africa. Noma initially manifests as a gum-related soft tissue lesion, a sore. After that, it evolves quickly into an acute necrotizing gingivitis that kills soft tissues before spreading to affect the skin and hard tissues of the face. The most recent figures, from 1998, indicate that there are 140,000 new cases of Noma per year. 90% of instances of Noma result in death without treatment. Survivors face social humiliation, have trouble speaking and eating, suffer from severe facial deformities, and need sophisticated surgery and rehabilitation. When Noma is discovered at an early stage, its progression can be quickly stopped with improved diet, antibiotics, and common cleanliness. Cleft lip and palate. The most prevalent of the craniofacial birth abnormalities, orofacial clefts, with a global prevalence of between 1 in 1,000 and 1,500 births, with significant variation among studies and populations. One of the main causes is genetic predisposition. Obesity during pregnancy, cigarette use, alcohol use, and poor maternal nutrition all contribute. There is a significant newborn death rate in areas with poor incomes. Complete recuperation is feasible if lip and palate clefts are surgically repaired correctly. Risk factors. The majority of oral diseases and ailments have modifiable risk factors, with the four most common NCDs, including using tobacco products, drinking alcohol, and eating a diet high in free sugars, cardiovascular disease, cancer, chronic respiratory disease, and diabetes. Additionally, it has been discovered that diabetes and periodontal disease development and progression are mutually related. Additionally, there is a connection between excessive sugar consumption and dental cavities, obesity, and diabetes. Oral health inequalities. The poor and members of society who are less advantaged socially are disproportionately affected by oral ailments. The prevalence and severity of oral diseases are strongly and consistently correlated with socioeconomic status, income, occupation, and educational attainment. From early childhood to later life, and among populations in high-, middle-, and low-income countries, this connection is present. Prevention. Public health initiatives that address common risk factors can lessen the burden of oral illnesses and other non-communicable diseases. Promote a well-balanced diet high in fruit and vegetables, low in free sugars, and favor water as the primary beverage. Stop using tobacco products in all forms, including areca nut chewing. Cut back on alcohol consumption and encourage the use of protective gear when participating in sports and riding bicycles and motorcycles to reduce the risk of facial injuries. Adequate exposure to fluoride is an essential factor in the prevention of dental caries. Twice-daily tooth brushing with fluoride-containing toothpaste, 1,000 to 1,500 ppm, should be encouraged. Access to oral health services. In most countries, access to primary oral health services is frequently insufficient due to an uneven distribution of oral health specialists and a lack of suitable medical facilities to satisfy population demands. Access to care may be significantly hampered by out-of-pocket expenses for oral health care. One of the main causes of catastrophic health costs is having to pay for necessary dental care, which increases the likelihood of poverty and other financial hardships. WHO's statement. At its 74th meeting in 2021, the World Health Assembly endorsed a resolution on oral health. The resolution urges a change from the conventional therapeutic strategy to a preventative approach that emphasizes oral health promotion in families, schools, and workplaces, as well as prompt, thorough, and inclusive primary healthcare. The resolution states that oral health should be firmly ingrained in the NCD agenda and that efforts for universal health coverage should include oral healthcare interventions. The World Health Assembly endorsed the Global Oral Health Plan in 2022 with the goal of achieving universal oral health coverage for all people and communities by 2030. To assist nations in putting the global strategy into practice, a comprehensive action plan is now being developed. This provides a framework for monitoring progress and measurable goals that must be met by 2030. Thank you for watching, keep your teeth clean and have a sugar-free day.